Hi, everyone. Thanks for getting here early. Hilda, feel free to get yourself some more coffee or whatever if you want, because I'm going to be introducing you for a minute. We're really lucky to have Hilda Bastian here as our speaker this morning. I'm going to be reading her bio off of my phone, so that's very modern for me. You'll hear soon that Hilda's a native of Australia, and she's a longtime consumer advocate from there. And then her career has turned towards talking about evidence, analyzing it, communicating about it, and working to make it more accessible. So it's a very interesting switch. I still consider her a consumer advocate, one of our world's most famous consumer advocates, and one who's really educated herself in and immersed herself in the evidence. What she does now is she works at the NIH at the National Center for Biotechnology Information and the National Library of Medicine. And there she's editor of PubMed Health and also post-publication evaluation of literature such as PubMed Commons and other things, I think. PubMed Health is systematic reviews. For those of you who haven't looked at it, it's for consumers and others like me to go in and find out what the systematic reviews say about a topic. It's really informative. Hilda arrived at NIH in 2011, and she had spent 7 years before that with IQWiG in Germany, in Cologne, Germany, where she had to speak German every day, and which sounds really scary to me. And there she was head of the Department of Health Information, and again worked on making evidence accessible to consumers. For those of you who aren't familiar with IQWiG, they're an organization within Germany that does systematic reviews of the evidence for insurance companies to help them decide whether they'll pay for something. Hilda knows much more about it than I do. But they're much more important than that, in that they really do fantastic work and research, and they're followed the world over. So I think they're real trailblazers in this field. So before that, before going to Germany, Hilda was active locally, nationally, and internationally in health consumer groups. And she spent time as chairperson of the Consumers Health Forum in Australia, which she helped to found. And she also helped to establish the Cochrane Collaboration, which is how I know her. And she was there as co-chair, that's how I remember her, in, what was that, 1993, around then, when we had our first collaboration meeting. And as a consumer representative. So she founded within the Cochrane Collaboration the Consumer Network, in addition to helping to establish the collaboration. And she was the first coordinating editor of the Consumer Communication Review Group. So finally, what does Hilda do in her spare time? She's a devoted Wikipedian, and she is does a lot of these, what are they called? Hack something, where you all get together and add to Wikipedia. Editathon. Yeah, it's not hackathon. It's editathon. And she's especially interested in stories of women and underrepresented scientists. And it's called Missing Faces, at Missing Faces. She cartoons and blogs. She does Twitter. And she does it about clinical epidemiology, evidence, and uncertainties. And this is her Hilda Bast, here at Hilda Bast, and she has a blog, Absolutely Maybe, and she's going to talk to you about absolutely everything. Hilda, here, you have to wear this so it's recorded.
G'day, can you hear me? Can you hear me now? Is that good? Okay, great. Thanks, Teddy. That was exhausting listening to. I think actually the hardest part out of all of that was learning German. It's sort of, to say you had to speak German every day, that sounds hard enough, but I actually had to learn it while I was doing it. So, okay, so I'm going to, Teddy had also said to me, talk about something that you're working on that you would really like to get feedback from people about. So that's actually what I've literally done that. So I'm hoping that you'll have a lot of sort of questions, suggestions and discussion. So I'll talk for less time, but if you can keep in mind that I really would like to pick your brains as I go through this. The first thing that I'm going to say, though, is that the views that I express are all absolutely personal. They don't reflect the views of anybody that I work for or blog for or any of those sorts of things. So this is a cartoon I made about the claim that science is self-correcting. It's something that people say all the time, and in a sense it's got, when I try to work out what people mean by that, they tend to mean that in a sense it corrects over time, that you might have this wrong idea and sooner or later somebody will work out that it's wrong and sort of knowledge advances. And that's actually not how it works at all. As everybody here would know, there's another side of this about self-correcting, and that is, do you ever go back and correct errors in the record? And that's one of the things that science is even worse at than the other part of it. And that's a bit what I want to talk about today. What does that mean for systematic reviews? This is like a really oversimplified schema for the ecosystem of the flow of information to the people who use it and make decisions. So we have this kind of idea that you can have these primary studies, and because nobody can keep up with the primary studies and you can't be expected to go back and try and make sense out of the conflicting original studies and juggle a whole bunch of separate sets of data, that we encourage people to use systematic reviews instead of going back to the primary studies, so that in that sense the systematic reviews replace the primary studies. And then often we have people will either use systematic reviews directly, or there's that whole process of knowledge translation. It could be that people use this, that people are then asked to rely, for their clinical practice guidelines, rely on the systematic reviews, or for clinician or patient information, whatever, rely on the systematic reviews, right? And then people will go and look at that knowledge translation material. So in effect what we've done is encourage people to use information right down at this kind of long process of various stages of synthesis and not go back to the primary studies anymore. And one of the questions that I've got now is one of the unintended adverse effects of this that systematic reviews have become a vehicle for the perpetuation of error. And that's really what I'm going to be talking about and what all the implications of that are. So we have this idea often that a systematic review becomes wrong or is a concern when there's new evidence, or something else new changes, a new adverse effect is identified or whatever, or there's a new primary study or a new treatment or whatever. And we put this colossal amount of effort into that whole issue of the times that that happens, gradually going back and updating the systematic, wanting to see updated systematic reviews. And then all of these things like clinical practice guidelines or whatever, sooner or later they should change. And we actually invest this enormous amount of effort into this. Early on in the Cochrane collaboration, me and a few people were trying to look, and the numbers wouldn't be all that relevant now because this was a long time ago, but we were trying to look at how often did one of these updates actually have something in it that would be meaningful to a clinician or a patient, this update, that it was really worth looking at that systematic review again. And at that time we reckoned it was about 15% of the time. And so if you consider what the enormous amount of effort and resources that goes into updating or redoing completely systematic reviews a few years later and that sort of thing, that's a colossal amount of theoretically waste. It's not really wasted, but in a sense, there's some ways in which it is. You have that thing, okay, 15% or 10% or whatever of time to find out that you're actually quite wrong about something is actually really quite important, and so that's worth it. But what about error? Now, if there's an error, this is my little symbol for error, this little yellow thing. There could be a mistake in there, and it might not at all be because the thing's out of date. It could be error for a whole lot of reasons. But error, actually, I've started to think, whether it's an error, whether it's an omission, whatever it is, I've started to think of it as like a virus, and that's why this is supposed to look like a virus. It could have come in at any one of those places and passed on through. So there could be an error in one of the primary studies, one or more of the primary studies. Then there could be, the systematic review might not pick up the error, right? If you actually start to think through the ways that these things go, sometimes the systematic reviewers will see something wrong with a primary study that the people who published the primary study or whatever never realised existed. Or that people who did the trial, and I'm going to talk particularly about trials because of the interests of people here, the trialists may have found an error, but they may have reported the error somewhere where the systematic reviewers didn't see it. You know, they might correct data in one place or another place, but say the systematic review is an individual patient data meta-analysis, and whoever discovered a mistake at some point in a trial forgot, oh listen, we've also got to go and notify the people that we gave this data to for the IPD, hey, we found an error. You know what I mean? There's all sorts of ways that even an identified error could bypass the systematic reviewers. Or the error could be discovered after the systematic review was done. Right? So this is a bit why the virus analogy actually really kind of helps me start to think through these things. When you start to think through it, this is an incredibly simplified diagram, but you end up with enormously complex pathways of how this error could be transmitted, if you'll bear with me with that analogy. I picked up, yesterday I just went to find just a couple of examples of different things to kind of give you an idea of some of the range of things we're talking about. This is an erratum notice. The only bit that matters here is to say, oh look, they had a denominator. It says it should have been 4,118, but it said 4,188. So it could be an error that somebody in a trial saw. It's sort of basic as that, right? That's kind of like one category. Here's another category. This is from a comment somebody put on PubMed Commons on a systematic review either yesterday or the day before, something like that, this week anyway. And this person who's made this comment is a trialist whose trial was included in that systematic review. And he says they got a number wrong. They put complications, they worked out, he said the N is 5, but in fact it was 9. And that changes according to this commenter. I haven't looked to see whether it was true, but this was this comment on PubMed Commons. Now, we'll notify the systematic review corresponding author that this has happened, and it'll be interesting to see what happens, but the odds are, 99% the odds are nothing will happen, because usually speaking, these don't. And that's an important thing to remember in this, that this is like your classic iceberg situation. You've got, I'm going to spend a lot of time later talking about published errors and identifiable and findable errors by other people, but the vast majority of them never get that far. And that would be true for all of us. There's heaps of times you see a mistake in a paper or whatever and you do nothing. Or people go to the effort of writing a letter to the editor and the journal rejects it and doesn't publish it. You know, all of those kinds of things. So even when we're talking about which of these things flow through the system and end up somewhere that somebody could find it, that's actually quite probably a tip of the iceberg, and we don't know how big it is. My third example is your kind of horror scenario, in a way, if you were a systematic reviewer. See this meta-analysis with these two trials in it. See the one with the yellow? That's got an editorial expression of concern. Regulators came in and decided there was a whole bunch of research misconduct with this trial, right? Now, and I'll come back to what that could mean. But an error or an issue with a trial can end up having this kind of an implication for a meta-analysis. So you would think in your kind of like ideal world, if you think about the way information flows down this thing, in your ideal world, every error that was found in a related to a trial every systematic reviewer would know about it. If the knowledge about it occurred after the systematic review had been completed, somehow this would all self-correct, wouldn't it? This is what you would hope for, and the knowledge translators would do it. But it would also like follow through eventually that there had been some error. Now, by error, I say that to be concise, to not go through all the kinds of things that can be invisible and that can be important. But what I really mean is error or omission. And it could be about the data, it could be something to do with a method, it could be there was something about their search strategy or their selection of studies, that they missed an entire study. That process of when you look at multiple systematic reviews, they almost never have exactly the same study pools in them, even when they're the same questions. It could be an error in their interpretation, or there could be issues around the ethics or conduct. So every time that I say error, unless I'm specifying erratum, this is that broad thing of what I mean. And there's a whole range of ways that this could come to light. Like I said, somebody could see it and they mightn't report it, or they could report it and it never gets anywhere that anybody sees it, or they report it somewhere where nobody's going to see it. They correct the clinical trials registry report, or this, that, or the other thing. There's this kind of a process. Or it could be in meta-research, that people go and find out, 60 of these trials used this method and therefore came up, this statistical method, and therefore came up with the wrong result. Or all the different kinds of things that people can find sort of en masse. And you could sort of have what could be, theoretically, a mass extinction event, but never is, right? So I started then at one point, I'll go back here. So I started to think, when I was looking at this thing, it was actually a paper that Ian Roberts, that I've had trouble finding again, from the Cochrane Injury Groups had written, and it was about retractions and systematic reviews. Now, he came from a particular area. He was really exercised about this, retracted trials, partly because part of his kind of beat is anaesthesiology. And there's been an awful lot of fraud from a few incredibly prolific anaesthesiology researchers in that field, including large numbers of trials that like the trials never even occurred, like never mind little tiny things. So the implications for systematic reviews in his world can be quite massive. I mean, I've seen some of these things where you've got 10 included studies in a meta-analysis, and 8 of them are trials that never occurred, right? So it's this kind of like massive and prolific problem. So of course he thought it was a really huge problem, the issue of systematic reviewers not taking into account retractions and fraud findings. And at the time that I read it, I thought, oh, rubbish, that's because it's, that's a specific thing, and it all relates to like 3 kind of fraudsters or whatever it is, 2, 4, 3, whatever, a few people, and the consequences of their actions. But at work, I had developed a couple of tools that I had been going to publicise, that researchers could use to do methodological research on things in PubMed and PubMed Health, and I thought I was looking for an example to test them out, because I didn't want to inflict people with these things until I'd worked out what happens when you actually try to use these tools for research. And I thought, oh, that's a good, quick, simple, easy thing to do. I'll check out how big a deal is this retractions thing really for systematic reviews, in the subset of systematic reviews that I've got all the references for, which was things like Cochrane and every systematic review in PubMed Central, and kind of wave your hand or look really vague if I use a piece of jargon that people don't know what I mean as I sort of go into sort of PubMed world, or the reviews that we digitise at PubMed Health and put into the system. So it's actually a really significant pool of systematic reviews that I can look at the citations for, and obviously I've got access to the back end of PubMed. So I thought I'll just do that. Now that was 2015, those tools still haven't been announced because I ended up in this incredibly meshed in this incredibly complex mire about this whole issue about error. I had thought, this is like so simple. All we have to do, or one of the things that we should be doing, is looking at this in a way that somebody who produces products deals with defective product recalls and letting people know about defects. And this is that like classic consumer kind of part of the consumer advocate coming back. I thought every single person who peddles information at any single part of this entire stream has got a responsibility here, because if something seriously has gone wrong, even if it's something minor for one person, it could be really quite major for somebody else. In one of their little meta-analyses, it might be the only data point even, We've got a kind of a defective product kind of problem. Well, there'd be all sorts of things that struck me that we could do and create at PubMed that could help people, at least for what was in PubMed. And I thought, oh, this is going to be easy. Quick, easy, I thought. Okay, so this is just the subset of types of what I call post-publication events that are identifiable in a database like PubMed. And they're things that occurred in one publication to another publication. So this is only a subset of that entire world that I was talking to you about. This doesn't include PubMed comments that are made or comments that are made on journal sites that don't get put in as, actually getting a PubMed ID and treated, as a formal record. So it's literally the things that have got PubMed IDs. There used to be a thing called partial retraction that disappeared at a certain point and are now classified as errata. But this is basically what you've got. You've got letters to the editor, which, as near as I can see, about half of them are about publications. The other half are, research letters or, whatever. There are errata that are clearly directly about. That will often include things like this person's name was spelt wrong, but it can include the kind of example that I showed you before. There's overwriting a previous publication, correcting it and republishing it, which sometimes involves just completely overwriting so that you can never really see what the difference was between one version and the other. There's retractions. There's withdrawn publications, which is a complicated thing for us at PubMed. Retraction also means withdrawn, but that's there's a complexity there. There's editorial expressions of concern. There's duplicate publications, which can be kind of like a concern about publication misconduct, if you like, but that really doesn't arguably, we'll come back to that, arguably that doesn't really matter to anybody else. And then there's fraud findings. In particular, we identify the ones in PubMed, some of them, that are from the Office of Research Integrity. So I thought, look, we've got a really good ability here to improve the people's awareness of these things. I looked at the evidence about how does error flow through that kind of ecosystem, or how visible are corrections of errors to people. And you find out that there is this enormous problem. Even when the things are visible, they're not visible to the things that people are doing. So I can look at, for example, updating guidelines for people about doing systematic reviews. And they don't say, go back and look at every single thing that you had included the first time to find out if there have been any questions about the validity of this stuff that you missed. That's not something that's routinely regarded as something that you should do. Some people do it, but it's not, like a part of the routine. And then you see there's a bunch of studies that people have done about why in particular, they tend to do retractions because retractions are this low-hanging fruit, and there's not that many of them, so they're quite easy to study, so heaps of people study them. And quite a few studies about why do things keep being cited, and not cited because they were retracted, but like genuinely cited with kind of no apparent awareness that this article was retracted. It basically tends to, most of the time, unless it's a really high-profile thing, most of the time, retraction is only a speed bump. It kind of slows down the citation rate of something. It doesn't really affect it all that much, And people who have done studies about that kind of thing find there's a range of reasons for this. People cite something because somebody else cited it. They cite something because, you cite something once, and then for the rest of your life, anytime you need an example of X or whatever, you go back and you find that thing, either in your reference library or from your previous article, and then you recite it, right? People take PDFs, and it's in their Mendeley collection or whatever. And people have done surveys of like the error in Mendeley. And of course, once you've saved this PDF, anything that changes thereafter is no longer there, So there's almost nothing about the ecosystem that enables error to be anything other than invisible. And what I found when I tried to do these simple things that I was trying to do was that there were a range of other problems that are by no means as obvious as those ones. So what first are we talking about in terms of kind of magnitude? Like, does this really matter? Now, don't take these numbers too seriously because, as I'm about to tell you, the ascertainment in PubMed is terrible. But for letters and comments, you're talking about 20,000 plus a year. Corrections and concerns, for perspective, PubMed now is like 1.2 million or something articles a year. And out of those, but that includes everything like from letters and all sorts of things. By the time you actually start to look at trials, the rate of these kinds of events tends to be quite high. It could be affecting, because these kinds of things happen quite a lot, specifically on clinical trials, more often on clinical trials than a lot of other things. They get a lot more attention from people for all sorts of reasons. And so they will get retractions, they will get corrections, they will have letters to the editor, that sort of thing. And it could be, don't hold me to this, but it's probably 10 or more % of trials, right, have some kind of post-publication event that's quite, of which a lot of them will be important. How important is a part of the research that I'm doing now and trying to work out how do you decide what important is, what the implications are of these different things. But you have these really rare events, which are retractions and ORIs. And then you have the errata. There's not that much. So what we did was, I thought, all right, look, here, in this sort of range of things, so let me just go back here. In this range of things, we decided we'd pick editorial expressions of concern because they weren't actually tagged as such or made identifiable in any other way. There's an effort, at least. In theory, the rest of these things, you can just find them, magically in PubMed. But these were never identified separately. They were just in there as a comment, the same as if somebody published an editorial in a journal at the same time as the publication was. It was just in with a whole bunch of other things. So we thought, look, this is good. It's possibly the rarest things, so we're dealing with a small number. This will be a good example. We'll try and find them everywhere, including on Google Scholar, all sorts of things. We'll work out the strengths and weaknesses of PubMed for post-publication events with editorial expressions of concern. Okay. So if you're interested in that particularly, there's this article and the data that we published earlier this year. The reason for this cartoon is to kind of say that you actually really do have this sort of a dichotomy. There's those things that authors themselves are concerned about, either that they want out there or they want to try and deflect people's criticisms and keep from getting out there, but there's the author side. Then you have editors and so on, but then you have also all of these outside people, regulators or readers or systematic reviewers or meta-researchers and all that kind of stuff. You have a range of things. But the only people that can really tag an article, either retracted or put something serious on it like an editorial expression of concern, is really the editors. Editors can refuse to retract publications, authors want retracted and all sorts of things. In the end, the power is with the editors. And this is the kind of numbers we're talking about. We only found a few hundred, but the use of them was increasing quite a lot. Now, the thing about this took more than a year, this project. And the reason it took more than a year this is not for you to read. This was an excessive amount of effort. For if you look at the end of this flowchart, you'll see we found 300 affected PubMed publications, and it took us several people, not full time, but we were really obsessed with it over a year. Why was that? I said we looked in PubMed, we searched for several of the big the major publishers like Wiley and Elsevier and all those things. You can search their entire set of publications. We searched all the major publisher websites, we searched Google Scholar. I mean, we really went to town, and all we found was these 300. But what we concluded in that process, I think we found an awful lot of problems about the system and thought them through and came to this conclusion. It is impossible, even for the published things, to find them all. But it could be greatly improved. So what are the kinds of things that... I've forgotten now what my next slide is. What is it? Okay. What are the kinds of things that I mean? At every point along the way, there's problems. And keep in mind now, we're talking about where people have published things. So people could have, like I said, if you would know yourselves, all the different places that trialists or whatever could lodge something. Then they could write, they could include it in some subsequent article that there was an error in their previous trial. And then there's absolutely no linkage between that kind of like revelation or whatever and previous research. Or they could mention it as an aside in a reply to a letter to the editor. They can go, oh, you're right. What we did was wrong, whatever. There's a range of places like that that don't necessarily get connected back. The journal might not realise it's actually relevant because they may say, oh yes, but that comes from this, it turns out this previous trial that we did, that's where the mistake comes from, whatever. Obviously the stuff from meta-research, because most meta-researchers don't provide you enough information to know which are the things that were wrong. A lot of people don't want to buy into that trouble of what that's going to mean. But then you have all these problems at journals that relate in some sense to two issues. One that's really obvious is the fact that most of these things are rare events and their systems are clearly not set up to deal with it. So they may have a content management system. It may have a place for errata. It'll have a place for letters to the editor, maybe, although a lot of journals don't even have letters or commenting or anything anymore. I mean, an awful lot of them don't. So that doesn't even exist. But they may, for something like a retraction or a republication or an expression of concern, there may be literally nothing in their editorial management system for them to know what to do with that thing. And so they come up with all sorts of workarounds for that. Sometimes they'll put it like, I think it's Science, one of the big kind of three. They put their expressions of concern, which are letters from the editor, they put them in as letters to the editor, just freestanding letters to the editor, things like that. So people sometimes find a place to wedge this thing in, but it's actually inherently misclassified, or they just find some way to insert magically into the thing some extra little note that's not going to be categorised any way, shape or form. The system may or may not migrate those things into the PDF. So there can be this really big difference between the PDF and the thing that's on the site, and that can just be kind of structural. And then you've got the whole issue of where you think it's hard to get away from the feeling that a lot of journals don't want people to see how many things are wrong with their previous publications. The extent to which they can be almost invisible on a page where this link is, even during retraction, is quite extraordinary. And the different language that they start to use and keep inventing for things, and then you look at it and you go, wait a minute, this is actually a retraction. That kind of thing leaves you, they're not necessarily vigorously wanting people to see, let's put it that way. So even if you were looking at the site, you mightn't find it. Okay, then you get to PubMed. And PubMed, then, you have that thing. Did the journal ever even report this event to PubMed? That turns out to be a very high proportion of these things. A high proportion of these 300 were never actually reported to PubMed. A bunch of them were reported to PubMed, but it disappeared at the journal website. Just gone. Why so many things disappear at journals, I can't tell you what that is. Sometimes you can see the reason for it. So this journal got sold from this publisher to this other publisher, and it got migrated across systems, and all sorts of stuff just disappears, you know, those sorts of things. Or somebody just, you know, redid their website, and these funny little odd workarounds that somebody had. There's no way that the people who organised this migration knew there was this category of item in there, and then they just disappear. But the rate of DOIs that disappear, the rate of retraction notices and whatever that have just completely disappeared, and the only place they exist in PubMed is quite surprisingly high. So you have missing data at the journals, or that nobody could find it without colossal effort, and you have missing data at PubMed, and who knows how much stuff is missing from everywhere, because certainly we found that in Google Scholar. So we would find retractions, the only trace of them that still exist was a blog post at Retraction Watch, you know, all of those kinds of things. So I'll stop, because I could go on and on and on about this, but the problem's quite large, because I'm tight. So what is there that we can do about it, and is it worthwhile? One of the processes that we've gone on to is developing some tools for us to try and work out what are the implications for a systematic review of certain types of events at trials. Now, there's this one study that was done back in 2004, and again, I think a lot of these things, you have to think, a lot of these things have changed a lot. One of the things that I didn't mention, if I look at the search strategy that these people used, it wouldn't actually be as good as they think it is for trying to find these errata. They were using PubMed, partly for the reasons that I said, but the other thing is that you've had all of these changes over time at PubMed in how it does things. You know, so for example, since 2015, there's been like a publication type erratum that in theory, when you can index it, it gets linked to the thing and so on. But before 2015, it was done in a different way, and there've been multiple kind of generations of how these things were done that people are not necessarily aware of. That, you know, so that at certain points of time, your search strategy isn't going to find certain kinds of things at all. And then you have this really big problem that if you're looking at anything about the linking of affected publications with post-publication events, you have this whole issue that PubMed, for example, they don't index things that aren't actually Medline index journals. So there's a whole lot of stuff that may be a completely online-only journal that's a PubMed Central journal that isn't indexed. And so then there are differences and issues there. Medline indexes don't index things that are e-published ahead of print. They wait until the actual published version. But that period of time that things are e-published ahead of print has got longer and longer and longer and affected more and more publications. And heaps of errata and retractions happen before it ever gets to print. So consequently, publications can come and go and never be Medline indexed. And all sorts of things can happen and it never gets indexed. A thing can get indexed and then the publishers change it. You know, they'll go back, instead of issuing a separate notice, they'll just go back and change the original. But indexes are never going to go back and look at that and monitor, has an abstract actually changed? Those kinds of things. So there's a really big set of issues there. With all of those provisos, they said that about 5% of errata could change the conclusions of a systematic review. That was their conclusion. I don't know if it's as high as that, but one of the things that I suspect is that there's nowhere near as much difference between these things as people think. There are retractions for issues that are completely trivial, and an errata issued that are way more important than a lot of retractions, and then there's a lot of things in letters to the editor and replies to letters to the editor that are more serious than a lot of errata and retractions. There There's a lot of findings of fraud that lead to absolutely no action whatsoever at journals, all of these kinds of things. And so the level of seriousness of these things and the things that people have given completely different names to and wedged things in between the system, we don't actually have, and that's sort of the work that we're trying to do, of trying to show the seriousness of these kind of events. People think of them as like a hierarchy, and they're not. I've seen people have retracted articles just because they've made a small change to the title, and then the authors have asked for the previous article to be retracted. Crazy, because they think it affects the citation rate or something or other. All sorts of odd things happen. So you really need to consider, I think, all of the different kinds of events. You can't just look at one. And each of them has enormously different issues about how you would retrieve them. So we need to kind of work out, as we go with each one, we're coming up with search strategies for how to do it. One of the solutions that I believe quite passionately in is that the process of the way that we deal with things has to change. We do have to have that defective product kind of mentality. So we're trying to establish a system that as we find ways to search for these things, that we search for them all the time and act on them really quickly and join things together and all that kind of stuff. But we're a very long way from being there. We're just about to have finished retractions, but we've still got a lot of other things to do. So where does this get to? And I'd like to sort of find out from people. I'm going to throw up a bunch of conclusions and issues and questions and things that I don't think that we've discussed enough, and it would be good to find out ideas about other challenges and possible solutions and how you would study this and any kind of ideas that you've got. One of theirs is that I think it's a mistake from a research point of view to treat systematic reviews as ephemeral, which in effect we do. We say it's out of date after a certain amount of time. And people have a tendency, not everybody, but everybody who does a systematic review doesn't necessarily go back and look for all previous systematic reviews on a subject. And it's really important, actually, that we do. And ignoring non-English ones is a really big problem as well. Because when you look at that ecosystem of information about a trial, very often the only permanent source of information relevant to a trial or an identified problem in a trial is in a systematic review somewhere. They could have got extra information from authors, they may have seen something, identified some anomaly or whatever themselves. But systematic reviews are the only source of information that's accessible about an awful lot of studies. That can be important for all sorts of reasons, but it's terribly important for errors. Taddy was referring to IQWiG before. At IQWiG, you can't get a drug reimbursed, and the IQWiG has a complete sort of social welfare system, so if nationally it's decided not to reimburse a drug, the drug may as well not exist, because Germans don't pay for their healthcare. If they actually had to pay for something themselves, they're just simply not going to do it. So it's like survive or die, and Germany is the third largest drug market on the world. You can't get public reimbursement of a drug if IQWiG can find that you've hidden any information about it at all, anything. You are then not eligible for reimbursement of that drug in Germany. So start to think about what the implications of that are for unpublished data about trials in IQWiG reports. It's massive, absolutely massive. But they're not translated into English. And with a real lot of systematic reviews, it had been one of the things that I tried to get in PRISM at one point, but it didn't make it through the consensus process to actually tag this, this systematic review has unpublished data of some kind in it. You can't find that out except for looking at each individual one. And that's a colossal problem. And then there's this aftercare is this word that Drum and Rennie used in an article many, many years ago about the responsibility of authors for aftercare of their work. What is everybody's responsibility here? And who has it? And in which direction? One of the examples that I put up at the beginning sort of showed you that. A trialist looking to see how his trial was represented in a new systematic review. Like, whose responsibility here is for this, and how good are our systems for this? When somebody notifies, hey, I found some real problem. What happens when journals won't actually publish those concerns? And, and how do these things go along? And who is responsible, and how do you get systems, especially if the problem is way down at the beginning of a primary study and people have got all these knowledge translation materials. What's the danger of relying just on systematic reviews? So some of the challenges are obvious, and I've already explained them. I think there is one, there's a lot that we've got to talk and think about what the responsibility is of people doing meta-research who are finding issues. What are we supposed to do there? I think open data and how you've classified things is really important, but I find that really quite difficult and challenging too. It's that kind of thing of to what extent do we say, we listed, for example, with the expressions of concern, we listed which were the journals that weren't identifying, PubMed of its changes and whatever. But if you start to think about that, it's a really big issue. Ethical and conduct issues and implications for systematic reviews is a really big one. We don't actually, there's a couple of articles about this, but it's not something that people talk about very much. And the divisions of opinion about this are really quite high. Some people do systematic reviews and they'll say if there wasn't adequate informed consent, we will not include the trial in the systematic review. And then you have issues where a trial gets retracted because somebody has found a concern about about some kind of ethical issue. And some systematic reviewers will go, well, we don't care about that because we don't think it affects the data. And other people will go, I'm not going to touch that because if these people, there was a very, very vigorous debate at a meeting that I was at where I was saying, well, I don't think a lot of these things are relevant. And these people were arguing, hey, if somebody lied to the ARB and they did this and this, why would I trust anything else about their trial? Do you know what I mean? But it's not a debate that we really have really quite openly, nor is it at all clear what actually is there that would actually so exclude a trial from consideration. There's the issue of invisibility of corrections in updates. It's a huge issue for the Cochrane collaboration because it just overwrites things. And people change things, and whether they actually report it as a change or not is, and what it's like for a lot of people as readers. You have a look sometimes at the abstract and go, is there a new trial? And if there isn't a new trial, you just move on. That might not be the only thing that changed. So there's a real issue. Cochrane doesn't issue errata really at all. It just doesn't do it. It just overwrites its mistakes. So, how do you actually, what does that mean for the ecosystem? And then there's the issue of the dispersed artefacts. The fact that there'll be so many multiple versions of the data and reports of the data in different places. And whose responsibility is it if there's a correction in one place to correct it all the way down the line, or if the journal won't correct it, what are people's responsibilities then, and what do you do? And what are all the things that we could do to make this easier for people? So I've left my email address as the last one in case people come up with ideas afterwards to send to me. But, questions and discussion. I hope there is some.
I have one. So you talked about trying to find a whole body of retractions. If I'm a systematic reviewer and I want to go back and look for changes to the articles that I've included previously, can I find all of that using Crossref and PubMed, or is this a hopeless task for systematic reviewers who want to do it?
Well, I think it's for each one of those kinds of things, there's a different set of challenges for every single one of them. So retractions are way easier than errata, for example. And one of the things that we're trying to do at the beginning, I thought this is going to be really easy. We're going to be able to do these quick searches and then fix do it at a system-wide level for PubMed, and it'll all just be there and we'll fix this. What we're actually doing is realising we have to work out a solution to every single one of these things. This here, this, every single one of these things. So we've done editorial expressions of concern, and we have a lot of recommendations and stuff in there. And nearly all of those 300 are now tagged in. Nearly all. They're getting close to having. Because what we do in our team, in the PubMed Commons team, doesn't mean that the Medline people are going to agree with our classification and that kind of stuff. And remember I said people call things strange things. It's very hard to develop search strategies for these things. It took us ages, even just for the many different ways that people will call something that we would classify as an editorial expression of concern. Even for the language of retractions is actually quite wide. So you actually need different strategies for each of them, and you definitely have to, either way, revisit at whatever the last chance you've got, the journal where something appears, and really scour all the fine print on the entire page, and look at the PDF as well, because sometimes it's in the PDF and not on the page. But not finding anything in a journal doesn't mean there's nothing either. So, I hope we're going to get there and kind of have that kind of thing. We're coming up with solutions for PubMed that people could then, so we have a search strategy, and you'll see it in the and it's not necessarily validated or anything like that. We've got one for editorial expressions of concern that we decided for practical purposes this is feasible for us to monitor everything that comes into PubMed using this. But that's, whether that's sort of sufficient for people doing systematic reviews. We'll have one shortly for retractions, and then we'll go through findings of research integrity findings, starting with ORI, as something that we can ensure with ORI is 100% there in PubMed. But then there are other agencies in other countries that we have to start to look at. And of course, individual universities, they don't publish those things at all. So there isn't. That's got to be a real culture change and a societal change to say that universities who've identified fraud in one of their employees, what their obligation is. They tend to say, for example, oblige the author. Say, one of the things you've got to do is contact the journals and ask for retraction of this, this, this and this. The journals don't necessarily do it, or even publish that they ever got such a letter. So that's a thing that's like completely under the waterline, that there just needs to be some kind of pressure overall that starts to say, you know what, you actually have to let people know that we found fraud. That's a particular separate set of issues. So as I said, with each of these things, some of it's discoverable and some of it absolutely isn't, unless there's really quite major changes.
Use either some of the citation databases, Scopus or Web of Science? It seems like some of this should be found there. Maybe, excuse me, maybe not all of it. And then the second question is, what am I supposed to do as a systematic reviewer? Do I need to go back and look at every single trial again?
I think you do. I think my question to the second one is, yeah, I think you do. I think you do. And you can't assume that it's going to be easy. Doing that thing of really scouring the journal and the PDF, both of a thing, that's going to get you a lot, but it won't get you everything. Now, what was your first question? Right. Yeah. You'll see that in our retractions one. You can see very quickly that they have, there's a real under-ascertainment problem of retractions at PubMed, but it's the best out of all of the options. We haven't sort of completely finished with the data yet. I don't know. Scopus has got far less than Web of Science, although they've got there's different issues with each of those databases. So we've particularly then concentrated on Web of Science. The DOIs are problematic. The DOIs kind of have virtually nothing that we don't have. And they have very, very little. It's like a drop in the ocean there. And because a lot of those DOIs are just plain broken, they're not that much use. Web of Science will be able to see with the retractions what the difference is there. And of course, because not everything is in PubMed, so once you get into, once you leave the PubMed world, the situation changes quite dramatically. But we're going to do that. Ironically, when we finish, so it'll be in 2 years by the time we finish retractions and the expressions of concern, errata and the letters are going to be the killer. Because the order of magnitude is so much higher and the discoverability is so much worse. And, people will just put in some subsequent issue of a journal, errata notices or Department of Correction or whatever, and list 4 things that may never be linked back to the articles with which they're associated. And even if there is a PubMed ID, there's nothing there's no abstract, there's nothing in the title that would tell you link it with this thing or whatever. And as I said, the order of magnitude is much more massive. So part of the project that I want to do about systematic reviews is, because it can't wait now for us to try and find all of them for the 27 million or 28 million PubMed records. That's going to take a really long time. So for this project, I'm going to test out a search strategy for finding all post-publication events that I can for the trials that are cited in a randomly selected set of systematic reviews, and see how many we find. And that won't be definitive, but it'll be a start. But it's not something that, with the exception of that Royal article that I have in here, I haven't seen sort of efforts to develop search strategies for this. If anybody's seen them, please let me know. There's some, there are some systematic reviewers that do it, but they haven't published articles about how they do it, like Margaret Sampson does it, for example. So there are some information specialists who do it, but it's not a thing that there's discussion about, or that these things are published, or whatever. And it's an interesting thing to me why this has never risen to any level of kind of awareness that I think it deserves.
Are you putting the information that you find about each paper somewhere central so that the next guy can find it?
What we do is we're doing open data for this. So up to the end of 2016, you can see it with that article. And then we have an open science framework place for all of these things, that if we ever do any extra data sets, we'll put them in there. But the process that we're actually trying to do with this is get to the end of our thing and then establish an internal process, which we hope will get adopted, and say, deploy resources in this way, use this search strategy all the time. I mean, I personally believe, once somebody at PubMed can see it, that's the kind of low-hanging fruit. Something's actually reported to PubMed. My ideal is to say within 2 weeks, this thing should be found and linked to something. But that becomes like a resource decision, and for people to decide we're going to change the indexing process to say we have this research integrity focus and a speed associated with it. So at PubMed Commons, we're monitoring that now. We've made our recommendations about expressions of concern. There'll be a set about retractions. But the thing that I would hope is that the NLM does as much as it can do and gets as much integrity in the PubMed record. The difficulty is that the journals are going in the opposite direction. You'll see it in these discussion papers at COPE and in different places. They want to avoid the stigma of a lot of these things. And from my point of view, a lot of the recommendations that people are discussing are going to make everything ever more invisible. And there are all sorts of reasons why people want to do that. But you've got kind of competing influences in this whole area, and they don't all go to discoverability and high visibility. That's not everybody's goal.
So I know that they don't, but if these different items had an NCT number attached to them, would they be pulled into clinicaltrials.gov? Would that be one way to find them?
That's a really great point. I actually got a really great cartoon about that. I could have put that in there. There's recommendations. It's an interesting thing. It's one of the flaws of both Consort and Prisma that they don't have real explicitly designed for making things discoverable by machines. So they will say, for example, put the clinical trial registry number should be in the abstract. But they don't put the information that humans who don't understand machines need to know, like don't change the clinical trials number. People will do things like leave off the NCT part of the thing, or put a space in between, or spell out NCT, and they do all sorts of weird things. And only a minority of journals and trialists actually do put it in the abstract. Which then certainly for something like PubMed, it's got to be in the abstract or you're not going to, machines aren't going to find it. For any paywalled article, no machine's going to find it if it isn't in there. And then systematic reviewers don't put all the IDs as they're included and excluded studies in. Some do, but a lot don't. And so that becomes that whole thing about what everybody's responsibility is for the dispersal of all of these things and how you connect it up. They will, clinicaltrials.gov will, every night the machine goes through and it'll hoover up things that have identifiable. I mean, one of the things that I instituted in the PubMed thing is that if there's a properly constructed, or there's just a blank in between NCT and the number, that the link is live to clinicaltrials.gov. For other registries, we can't do it because a lot of registries don't have the trial number discoverable that way. There's some registries you even search for an ID number and you don't really find the thing. You have to have more things, but they don't necessarily have them in the URL and stuff like that. So clinicaltrials.gov will hoover up all the ones that it can see and attach those to the record. But like I said, that's a minority. And Ben Goldacre and his team, they're doing a thing that's like created this whole other place that everybody's supposed to say, okay, we have this new place where everybody should notify things. And it's really pushing things uphill to create some completely new place and say, go there. And that's what sort of people keep doing in lots of ways. But I kind of think that's really hard. There's got to be the sources, which could be the journal article if it's a journal, but then you get into those things that are the ones that are in the grey literature, like hands up here who knows what AHRQ does about corrections to AHRQ systematic reviews. There's a thing. There's that thing, because in the grey literature you have people who they don't, the way I said that came home in bad. You can't necessarily expect people who aren't librarians or journal publishers to know how these things are supposed to go.
I was just going to ask, how have things changed in terms of, internet versus pre-internet, and in terms of disseminating corrected information and stuff prior to the internet and online resources?
Some things are better, some things are worse. On balance, they were better pre-internet. Post-internet, a lot of stuff hasn't been digitised. This bit's digitised and other critical bits aren't, and that sort of stuff. And of course, that problem of the fact that a real lot of people put their critiques and stuff not freestanding and attached to the original thing, they embed them in a later paper that they write and all that kind of stuff. That's as impossible on both sides as it ever has been. Post-internet, you've got this kind of enormous increase in online-only journals that don't even have a lot of mechanisms for things. They can be really streamlined journals and don't have letters to the editor. So, and some of that, it's related to post-internet, but it's to do with the sheer quantity. And then the reduction in resources that people put per activity or per article in order to make something feasible or profitable at a much larger scale. You know, a lot gets lost. Because if you consider, look, if you think as I do, for example, it's a completely personal view, that a journal is responsible for the errors in every single thing it ever published. And it has this really big responsibility for its entire corpus. Think about your level of responsibility for your own articles that you've written. How much aftercare is there involved? What if you have to look at every... I mean, I had one point where people on PubPeer were ripping apart something that I wrote, you know, and these alert emails were coming like every 20 minutes or something. Ping, ping, ping. So imagine if you're going to try to keep up with every tweet, every comment anywhere, every blog post about anything you ever wrote, and put that like on scale even just for yourself. I mean, in this process, I found letters to the editor about articles of mine that I had never seen before, you know, and I was like, oh, that would have been good to know. You know, I had this like odd idea that journals would tell you, well, you know, maybe they would have, but I've moved country several times, never mind institutions, how are they going to find me, you know? So, yeah, it's a really, it's actually got more complex and harder. But in theory, it could be easier if things were more machine readable and so much wasn't behind paywalls. And that's my email address. For if you've got things to send me afterwards. Thank you.
Hilda said she'll hang around a little bit.
What have I done?
To talk to people who have questions. So, but thank you all very much. Thank you.